Assalamualaikum. Today I will discuss about contraindication of some drugs. Contraindication of some drugs like beta blocker. In CVS there is heart block, brady, arrhythmia, bradycardia, hypotension, peripheral vascular disease. This is CVS. And other, there is bronchial asthma. Bronchial asthma, beta blocker is contraindicated. Beta blocker is contraindicated in bronchial asthma patient. Then dyslipidemia, another is diabetes mellitus, another is patient with depression. Now this is calcium channel blocker contraindication, in which patient it is contraindicated. Heart block, bradyarrhythmia, bradycardia is a heart rate less than 60 beats per minute. Hypotension, peripheral vascular disease, bronchial asthma, dyslipidemia, diabetes mellitus, patient with depression. Now calcium channel blocker, heart failure patient, and another is second and third degree heart block. Heart failure patient and second and third degree heart block. Now ACE inhibitor, in pregnant women, ACE inhibitor is contraindicated. Another is hyperkalemia, because in ACE inhibitor increase potassium level, which may causes cardiac arrest. Progressive deterioration of renal failure. If patient is renal failure, progressive deterioration of renal failure, bilateral renal arterial stenosis. Another is ARB, angiotensin receptor blocker, in a renal failure patient. ARB is contraindicated. Renal failure patient. Then hyperkalemia, pregnant women, ARB is contraindicated. Bilateral renal artery stenosis. If a patient is taking ACE inhibitor or ARB as low certain, so this drug is contraindicated when she is pregnant. Digoxin is contraindicated in ventricular fibrillation. Arrhythmia, in arrhythmia, digoxin is contraindicated. AV heart block, atrioventricular heart block, hypokalemia, hypercalcemia. And another is liver and renal failure. So I repeat, uh, what is the contraindication in beta? Who are the contraindicated to use beta blocker? A heart block patient, bradyarrhythmia, bradycardia, hypotension, peripheral vascular disease. Another is bronchial asthma, asthmatic patient, dyslipidemia, diabetes mellitus, patient with depression. Mm, and now, what is the calcium channel blocker? In which person calcium channel blocker is contraindicated? A heart failure patient, second and third degree heart block. Angiotensin receptor blocker is contraindicated in pregnant women, hyperkalemia, renal failure, bilateral renal arteries. ARB, angiotensin receptor blocker, is contraindicated in renal failure patient, hyperkalemia, pregnant women, bilateral renal artery stenosis. These four are same. Then digoxin. Digoxin is ventricular fibrillation, arrhythmia, AV heart block, hypokalemia, hypercalcemia, liver or renal failure. Thank you very much.